Speaker, my question is to the Minister of Health and Long-Term Care. Ear Falls is a small northern community of 1,100 residents, almost all of whom are dependent on the town's only doctor, who will be leaving on December 31st. If a new doctor is not in place soon, residents will be forced to drive either 140 or 280 kilometers to access urgent and primary medical care. Ear Falls is doing everything they can to find a doctor or secure a locum, and other doctors nearby are trying to help, but the ministry will not return the town's calls or emails. Minister, what is this government doing to ensure that the people of Ear Falls don't lose their only doctor, and why will the Minister of Health and Long-Term Care not return the clinic's calls or emails?
Thank you. Minister.
Well, thank you, Speaker, and I thank the member opposite for raising this issue. Speaker, this government has put a very high priority on increasing the number of doctors working in this province. In fact, Speaker, by 2013 we will have doubled the number of new doctors entering practice each and every year. In addition, Speaker, we've made a very high priority of increasing physician coverage in the north. In fact, we established a whole new School of Medicine in the north, the Northern Ontario School of Medicine, and what we're finding, Speaker, is that what we had hoped would happen is happening, that doctors are coming to the school from the north and they are staying and practicing in the north. So we're working hard, Speaker. There are still communities where doctors, where there is a physician shortage, and I will in the supplementary happily talk about the Northern Rural Retention Recruitment Fund.
Supplementary.
Mr. Speaker, I've only been in this legislature for 3 weeks, and this is the second time I've had to ask this government to ensure that my constituents have access to local medical care. On Monday, I asked the minister about the Rainy River ER, which is on course to close in the new year because of the ever-present doctor shortage. It's clear that residents of Northern Ontario are not getting the help they need. It's clear that government policies are a barrier to medical care in Northern Ontario, and that this government is unwilling to work with the communities to find solutions. When is this government going to get serious about the health care challenges facing Northern Ontario?
Speaker, I do want to say to the member opposite that I am more than happy to spend some time with her so that she understands that we can actually answer these questions, Speaker, informally between your office and mine, and we are more than happy to work with members on specific cases. Speaker, the issue in Rainy River, actually, that was raised earlier, I was very happy to tell the legislature and update the member that we were able to find coverage through Christmas, Speaker, and are working on 2 more days in January that still we have not found coverage on, but we will work hard and continue to work hard. Speaker, we have a very proud record in this House. Since we have been elected, we have never had an unplanned closure of an emergency department, Speaker, in stark contrast to what was going on prior to it.